Assalāmu'alaikum Warahmatullāhi Wabarakātuh. Hello everyone. Good morning, good afternoon, and good evening. How are you doing? I hope you will be great and healthy as always. So, we are from Group 8. My name is Shaida Rahma. You can call me Shaida. And my friend.
Hello everyone. My name is Sri Ratnaningsih.
Hello everyone, my name is Yola Virgin Andriani.
Hello everyone, my name is Santika.
We're on our second year in nursing study program, Poltekkes Kemenkes Tasikmalaya. Now, we will discuss about topic that is explaining medication. In this topic, we're going to learn some types of medicine, the different in vocabulary, abbreviation for prescription, useful expression, and demonstration. Jadi di video ini kita akan membahas tentang tipe-tipe pengobatan, perbedaan dalam kosakata itu sendiri, dan ungkapan-ungkapan yang harus kita ketahui ketika kita akan menjelaskan terkait pengobatan atau obat-obatan kepada pasien. Dan di akhir video nanti kita akan menampilkan demonstrasinya. So, no need to wait for longer. Let's watch the video.
Hello everyone. Now, I will explain how to administer drugs when experiencing illness. Of course, we will be given treatment to recover from certain disease. There are different ways of giving medication to the patient. The first, medication by inhalation, is a drug that is given directly into the airways via inhalation. The second, medication by injection, is a semi-solid blend. Service for topical application on the skin or mucous membrane. The third, rectal medication is a drug that is administered rectally. The fourth, medication by dropper, is a drug that is given via dropper. The fifth, medication by injection, is a drug by injection that can be done in several ways, namely intravenous, intramuscular, subcutaneous, and intrathecal. The latter sublingual medication is a tablet that is placed under the mouth. The question is the advantages of injection drug administration.
Hello everyone. Now I will talk about differences between pharmacy or dispensary and drugstore. That said, have you ever come across words like pharmacy, drugstore, and dispensary? The three places are related to the place of selling and distributing. But is it actually the same place, or is there a difference between one another? Are they the same? Let's discuss pharmacy, dispensary, and drugstore. Pharmacy or dispensary usually refers to something. First, for place in hospital where medicine are provided. Secondly, it refers to place outside the hospital where medicine are sold, or what we usually call a pharmacy, while drugstore refers to a drugstore. Although they both sell medicine, they actually have fundamental differences with each other. First, the title pharmacy can be replaced by dispensary, but medicine store cannot. And second, pharmacy might use RX logo on its name, But drugstore cannot use the RX logo. And the third, in the pharmacy or dispensary, there is a pharmacist, while in drugstore, there is not. And the fourth difference is, in pharmacies, prescription drugs are dispensed which are under supervision of a pharmacist. And the last one is that pharmacists sell some only controlled medicine. Drugstore only sell ordinary drugs, such as cold and flu medicine and other medicine that do not require a prescription. The question is, mention examples of medicine and drugs.
Hello everyone. Now I will explain about vocabulary which often appears in the topic of medication. Okay, the first vocabulary is prescription. It means resep dokter in bahasa Indonesia. The second vocabulary is receipt. It means tanda terima in bahasa Indonesia. The third vocabulary is to relieve. It means menghilangkan rasa sakit in bahasa Indonesia. The fourth vocabulary is to shake. It means mengocok in bahasa Indonesia. The fifth vocabulary is one spoonful. It means 1 sendok makan or 1 sendok takar in bahasa Indonesia. The sixth vocabulary is pill. It means kapsul in bahasa Indonesia. The seventh vocabulary is adverse reaction. It means kontraindikasi atau reaksi penolakan dalam tubuh in bahasa Indonesia. And the last, eighth vocabulary is medicine. It means obat in bahasa Indonesia. Well, that is vocabulary that often appears in the topic of medicine. So, I have a question for you. Okay, the question is, what difference between drug and medicine? Okay, the question is, what difference between drug and medicine?
Everyone, now I will share with you some useful expression in explaining medication. Okay, the first one is oral medication. Oral medication is the administration of drugs by mouth, either in the form of tablets, capsules, syrups, and other dosage form. Below are a few examples. The first example is, please take this 1 tablet per day or 1 tablet 3 times a day every hour. Or if you want to replace the syrup, for example, please take this syrup 1 spoon 3 times a day. It could also be if you want to add the benefit of these oral drugs. For example, please take this to reduce your temperature. Okay, next is the expression in giving caution to the patient. Here are some examples of sentence in giving caution in patient. Just tell if there you don't understand and I'll go over it all. Other example include, you must call the nurse if there is an adverse reaction. So an adverse reaction, e.g. rash or redness of skin, swelling. The next example is, don't take this more than 3 times or 8 tablets in 24 hours. Next is the patient expression related to medication. Patients who do not understand how to use drugs, how to take drugs, can run with the following expression. For example, how should I take this? The second example is, what's the use of this tablet? Or what's the use of this drug? Or what's the point of this capsule? The third example is, how to use this tablet? The question is, how to pay caution to patients who do not want to take medication?
Answer the first question. The question is the advantages of injection drug administration. The first, injection drug can give physiological effects for certain disease condition. The second, it's good for sufferers who cannot have oral consumption. The latter, it can be given for perversion that are damaged by gastric acid secretion.
Okay, I will answer the second question. The question is, mention examples of medicine and drugs. Well, some examples of medicine are mefenamic acid, paracetamol, naproxen, decongestant, and many others. Meanwhile, drug examples are heroin, cocaine, marijuana, ecstasy, and more than 65 kinds of types.
Okay guys, I will answer the third question. The question is, what difference between drug and medicine, right? Okay guys, drug and medicine both can be said to be obat. Okay? All medicine can be called a drug, but not all drug can be called medicine. Okay? For example, if doctors use morphine as a cancer drug, this morphine is medicine. However, when uses this morphine can only be called a drug. Okay, in short, the medicine has the meaning. The treatment of illness and injuries by doctors and nurses. But drug means something that is forbidden or illegal.
I will to answer the fourth question. The question is, how to pay caution to patients who do not want to take medication? Okay, so what needs to be done when the patient does not want to take the drugs is the first to do it casually without rushing. Coercion and the urge to take medicine immediately can provoke anger to the point where the patient refuses to take medication. Let him take the medicine in his own way. Next, look for alternative drinking frequencies and ways. If the patient refuses to take medication because of difficulty swallowing the pill, ask the doctor to take the liquid form. Next, make a simple, clear, and concise explanation of its uses and the possibility that will occur if the medicine is not taken. So many answers from me. Hopefully it can be understood. Thank you.
Good morning, Miss Shola. Are you feeling better? Is there any progress with your condition?
Yes, doc. I'm feeling better, but sometimes I feel really nauseous. Is it normal or not, doc?
Okay, has the vomiting and diarrhea stopped?
It has, doc.
Yes, that's really normal. That symptom indicates you will be healthy. May I check your body temperature and blood pressure, please?
Yes, of course, doctor.
A few moments later.
Okay. After I check, your body temperature is 38 degrees Celsius and your blood pressure is 110/60. I can diagnose that your health is getting better, your blood pressure has been normal, but your temperature is still high. You need to have more rest to make it better.
How about the medicines?
The nurse will give the medicine that I recommend. By the way, how's about the service here? Is there any problem about it?
I am satisfied about the service. The nurse is very friendly and the facility is very well. They also keep my room sanitation, so I am very comfortable being cared here.
Okay, I have to visit the other patient. If there is complaint about your condition, just call me and I will come to your room. Get well soon and good morning.
Okay, doctor. Thank you for checking me today. Good morning.
You're welcome.
Assalamualaikum.
Waalaikumsalam.
Miss, this is a prescription for the patient on behalf of patient.
One moment please. I'll have it ready for you shortly.
Certainly, thank you.
A few minutes later.
Okay, later I will explain the medicine therapy directly to your patient.
Alright, thank you Miss Antika.
You're welcome.
Good morning, Miss Yola. Introduce, she is Miss Santika. Here, Miss Santika will explain about medicine therapy.
Thank you, Miss Ratno.
My pleasure.
Okay, Miss Yola. My name is Santika. I am in charge of the pharmacy at Pros Hospital. Here I will explain a little about drug therapy to you. Can I start this?
Yes, please.
Based on the notes here, you have nausea and fever. Is that true?
Yes, miss.
Okay, here's the medicine for you. For nausea, take this white tablet 45 minutes before meals twice a day. And then, this white tablet, take it only when you have a fever. Any question?
No, miss.
Okay, then don't forget to take the medicine according to schedule. And hopefully get well soon. Good morning.
Thank you, miss. Good morning.
You're welcome.
Okay, Miss Yola, at 1 o'clock in the afternoon, I will visit again to administer medicine.
Yes, miss.
If there is a need, your family can meet me in the nursing room. Hopefully, get well soon. Good morning.
Okay, thank you, miss. Good morning.
You're welcome. Assalamualaikum.
Waalaikumsalam. Good afternoon.
My name is Nurse Ratno. I'm a nurse in this room. Is that right with Miss Yola?
Yes, true.
How's it going today, Miss Yola?
I still feel nauseous and vomiting.
Well, here I will take the action of administering the drug orally. The time is approximately 5 minutes. Do you mind?
No, I don't.
Miss Yola, have you had breakfast?
Not yet. Since morning, I haven't eaten.
Fine then. I will take action now.
Fine, Sus?
A few moments later.
Okay, the medication is over. What do you do, Miss Yola?
Alhamdulillah, I can swallow the medicine. It's just a bit bitter.
Alright. Then, excuse me to return to the room.
Alright. Thank you very much.
You're welcome, Miss Yola. Excuse me. Assalamualaikum.
Waalaikumsalam.
Okay guys, we can't believe it's at the end of the video. So, hopefully this video can be useful for all of us. Thank you for watching and see you!